Hi, today we'll talk about nursing history and how it applies to nursing today. This course has been very helpful and where we've learned a lot of information about nursing history. The book that I've chosen to read over the term is Susan Reverby's book, Order to Care, The Dilemma of American Nursing from 1850 to 1945. This book just gives a great study of the dilemmas faced by American nursing and just again between the ages or the dates of 1850 to 1945. But there's an overall history discussed in this book, many questions raised by by women's history and the social history of healthcare. Um, we've been raised in a society and a society overall that has refused to value caring and just care of patients in general. Of course, money always comes into play. Lots of other political policies and things like that to look at. But Reverby does a good deal of help to help us understand what the um, implications of for nursing care and uh, and what we can learn through that. So, so as far as pedagogy, and how she teaches us, she does talk about the society's thoughts, just in general on work ethics. She uses economic situations of the times to teach. She also discusses lots of nursing advocates in her book and the pleas that they had over time to again get government and healthcare in general to kind of change and to support the women in general. We look early on in nursing where nurses were mostly family members, female family members who were taking care of their families, and then into friendships and things like that. And then it just became a need for being a paid career as these women were out of their homes taking care of others. So again, that push to, get nursing to be a better viewed profession and a better supported profession. And Again, we just see how these changes in history have really helped us as nurses and to again give us that respected profession that we have. As far as the evidence in the history of nursing, Riverby does talk about, many truths with women's positions throughout the years. Obviously being much more of a lesser gender over the years, but then, how we've kind of with the feminist movements and things like that, we've definitely changed in our careers. So, time, history definitely teaches us much about so many things in life. Reverby again, talks many descriptions, and things that were needed in the nursing profession as we, go from more of the private homes and care to needing more hospital care needs, and taking care of larger patients. Patient populations and things like that. But Riverby did discuss the example of efficiency in nursing. Of course, the nurses were originally very disappointed in that. They didn't want anybody to really tell them how to do their nursing jobs. But again, as they saw through evidence, they saw that the efficiency was actually a benefit to the patients and to themselves, just being in a hospital situation, to be able to, take care of more patients, have all the equipment nearby, things like that. So we do see that with these changes, that most of these things have kind of stuck around over the from the past to the future. I'm sorry, to the current time frames. Then we go into look into explanation in history, and we do see that how the past and the current, future nursing dilemmas, how they all connect, how they all work together. Understanding, how change is made over time. We definitely saw a lot of viewpoints and for the nurses changing by reading this book and kind of it was almost comical at times to hear how the nurses were really resisting change. We just see that we need to change today as nurses. Nursing has always been a very empowering profession, and particularly for me, just being excited to be a nurse. We definitely have our, own, we autonomy and how we can work, and of course the desiring to care is hopefully very standard for all nurses. So this, course has been very beneficial for me, and I have enjoyed learning about the history of nursing.